Wanna pass the NCLEX? Then let's get started. Today we'll cover 10 questions on alterations in body systems. Question 1. A patient presents with severe chest pain radiating to the left arm and jaw, diaphoresis, and shortness of breath. Which of the following is the priority nursing action? Obtain a detailed health history, administer oxygen via nasal cannula, provide reassurance to the patient, administer nitroglycerin as ordered. Pause the video and select your answer. If you chose option B, you are correct. Administer oxygen via nasal cannula. The patient is exhibiting signs of a myocardial infarction, heart attack. Administering oxygen helps to increase the oxygen supply to the heart muscle, which is crucial in this situation. Question 2. A patient with chronic obstructive pulmonary disease is experiencing increased shortness of breath. Which of the following interventions should the nurse implement first? Increase the oxygen flow rate, encourage pursed lip breathing, administer a bronchodilator as ordered, position the patient in a high Fowler's position. Pause the video and select your answer. If you chose option D, you are correct. Position the patient in a high Fowler's position. Positioning the patient in a high Fowler's position helps to improve lung expansion and ease breathing. Question 3. A patient with diabetes mellitus has a blood glucose level of 600 mg per dl and is diagnosed with diabetic ketoacidosis. What is the nurse's priority intervention? Administer insulin as ordered, provide a high sugar snack, encourage oral fluid intake, administer potassium supplements. Pause the video and select your answer. If you chose option A, you are correct. Administer insulin as ordered. Insulin administration is critical to reduce blood glucose levels and address the underlying cause of DKA. Question 4. A patient with chronic kidney disease is scheduled for dialysis. Which assessment finding would require immediate intervention? Weight gain of 2 pounds in 24 hours, blood pressure of 150 over 90, decreased urine output, elevated potassium level. Pause the video and select your answer. If you chose option D, you are correct. Elevated potassium level. Hyperkalemia, elevated potassium, can lead to life-threatening cardiac dysrhythmias and requires immediate intervention. Question 5. A patient presents with a suspected peptic ulcer. Which of the following symptoms would support this diagnosis? Right lower quadrant pain, pain relieved by eating, steady pain radiating to the back, hematemesis. Pause the video and select your answer. If you chose option D, you are correct. Hematemesis. Hematemesis, vomiting blood, is a classic sign of a bleeding. Question 6. A patient is admitted with a suspected stroke. Which of the following assessment findings is most indicative of a stroke? Severe headache, sudden onset of confusion, gradual loss of vision, fever and chills. Pause the video and select your answer. If you chose option B, you are correct. Sudden onset of confusion. Sudden onset of confusion is a hallmark of an acute stroke, indicating a disruption in brain function. Question 7. A patient with a fractured femur is at risk for developing fat embolism syndrome. Which of the following symptoms would indicate this complication? Petechiae on the chest and neck, decreased urine output, pain and swelling at the fracture site, fever and chills. Pause the video and select your answer. If you chose option A, you are correct. Petechiae on the chest and neck. Petechiae, small red spots on the chest and neck, are a characteristic sign of fat embolism syndrome. Question 8. A patient with severe burns is at risk for developing shock. Which of the following would be a priority assessment? Monitoring urine output, measuring body temperature, assessing pain levels, checking the electrolyte levels. Pause the video and select your answer. If you chose option A, you are correct. Monitoring urine output. Urine output is a key indicator of renal perfusion and fluid balance, critical in burn patients at risk for hypovolemic shock. Question 9. A patient with sickle cell anemia is admitted with a vaso-occlusive crisis. Which intervention should a nurse prioritize? Restrict fluid intake, apply cold compresses to painful areas, administer pain medication as ordered, encourage physical activity. Pause the video and select your answer. If you chose option C, you are correct. Administer pain medication as ordered. Pain medication is critical in vaso-occlusive crises to relieve severe pain and stress associated with the condition. Question 10. A patient receiving chemotherapy has a significantly reduced white blood cell count. Which of the following actions should the nurse take to prevent infection? Administer antibiotics prophylactically, place the patient in a private room, encourage the patient to eat fresh fruits and vegetables, limit the patient's fluid intake. Pause the video and select your answer. If you chose option B, you are correct. Place the patient in a private room. Placing the patient in a private room reduces the risk of exposure to infectious agents, which is critical for immunocompromised patients. Click that subscribe button and join us next Wednesday.